Oh, my head. This is Dr. Cuddlesack returning a page for internal medicine consultations.
This is the surgical intensive care unit calling a few consultations for you.
It is 4:30 in the morning. Who is writing consults now?
I had to chart on 6 patients, and we are severely understaffed, so you have no right to be angry at me. Also, I spilled some buffalo wing sauce on the orders, and couldn't read them until now.
Give me the first patient.
The first patient is a 93-year-old African-American male who has a 5-centimeter interparenchymal hemorrhage with midline shift and herniation. He has Chen-Stokes respirations and his oxygen saturation is 50%. Jimmy from Dietary just came by and said that sucker looks bluer than my balls after a night at the Pink Pony.
Did the patient aspirate?
He doesn't look like the type of guy to take it up the rear.
I think you just mistook the word aspirate for aspirate.
My bad, so what does aspirate mean?
It's what happens when you put a finger or an object of similar length and color in the back of your throat. I'm sure you have had multiple experiences with aspiration with Gimme from Dietary.
You think I am ignorant? I can't believe what you are suggesting. Jimmy's cooking has always tasted good.
Why is internal medicine being consulted?
Because the patient has a glucose of 198 and needs intensive diabetes management. Neurosurgery is not planning intervention on this patient and is not comfortable with management of his diabetes. Dr. Pendelman in neurosurgery also wanted me to tell you he hasn't seen so many blown and dilated pupils since he attended Catholic school. I have just made you the primary physician on this patient.
Fine, just give me the next patient.
The next patient is a 32-year-old nursing home patient with end-stage renal disease on dialysis. He also has AIDS with a CD4 count of 1. We removed his last white blood cell while checking his last white blood cell count. He has cytomegalovirus colitis and has 10 to 12 bowel movements a day. He has lost 60 pounds during his 10-month hospitalization. He has dozens of stage 4 decubitus ulcers and is so contracted he can fit into a gym bag for easy transportation. He has progressive multifocal leukoencephalopathy, cerebral toxoplasmosis, cerebral palsy, herpes encephalitis with Kluver-Bucy syndrome, and hepatitis C from his prison tattoos. He requires 10 to 12 units of blood a day to stay on top of his massive gastrointestinal bleeding from his fungating anal carcinoma. He has a tracheostomy and a peripheral epigastric tube, and a colostomy. His Glasgow Coma scale is 3. The patient is also now in a systole.
What is the reason for the consult at 4:30 a.m. after he has been here for 10 months?
Medical management. He also has a heart murmur. The primary team wants you to fix his chronic illnesses right now.
Fine, I'll be right there.
Wait before you hang up. All the nurses sitting next to me all have consults as well.